Using an MRI machine, we can tell the density of someone's brain. When someone says you're dense in our society here in America, oftentimes that insinuates a negative or pejorative comment about the person's intellect. However, interestingly, a dense brain is exactly what we want to have. Using the MRI machine like you see behind you, we can then run the information through another system to tell the density of the brain. In many ways, it's never been a better time to assess one's brain health. Which brings us to today's topic: can diet help us to prevent the development of Alzheimer's disease? I'm attaching a study for all of you to review. Let me know your thoughts and questions. Interestingly, what the researchers found was that markers from the brain, which are certain proteins we can use in the assessment also of memory loss conditions, were reduced when eating the Mediterranean diet versus when eating the Western diet. They basically found that these pathological proteins increased. The inference is that possibly diet in the early stages may be something we can use to prevent the later development, 10, 20, 30 years away, of a neurodegenerative condition like Alzheimer's disease. I'm not saying that diet is the cure, but given the tsunami of Alzheimer's disease patients that are thought to be on the horizon based on the current literature, tools like the MRI you see in the background, doing these routine blood tests, can have huge impact, not only on the individual's life, but the lives of loved ones who are ultimately going to have to care for someone who has a memory-related condition. For those of you who want to know, some of these blood markers are A-beta 42/40 ratios and p-tau 217, other forms of tau. There are a lot of nuances to those words. I can make other videos on that, but in essence, I hope you find this talk helpful. Let me know your thoughts. Dr. Randall Gates, board-certified chiropractic neurologist, chiropractic physician from Gates Brain Health and Advanced Imaging Reno.